Hello, my name's Vicki. I'm the plastic surgery nurse specialist at Stiano. I haven't been here very long, just a few months. However, I have known Mr. Khan for a long time, and today I've decided to take the plunge and have my eyelids lifted.
My name's Karan Khan. I'm one of the consultants that works at the Stiano clinic. The condition that Vicki is describing, that of an upper eyelid correction or blepharoplasty, is very common. As we all get older, then with the effects of gravity and some genetics, then different parts of the face can age a little bit and you can get some skin excess. It's a common inquiry that we get here at the clinic, and it's something that's actually surgically quite easily correctable, and it has a very good success rate. Okay, so I'm just looking at Vicki, and this is something that I would do for anyone who came into the clinic to discuss this. And it's something that you can do yourself at home. So this is called a pinch test. What you're essentially doing is taking this bit of skin here and just seeing yourself whether there is excess. The idea with any surgical correction is to remove this fold of skin, okay? It may be that there's some muscle underneath it that also needs to be removed, and quite rarely, sometimes there can be fat that's also bulging underneath. I think in Vicki's case, it's largely a skin excess that is the problem. And so it's removing this area, and then the scar would be sitting in that natural skin crease. Sometimes we need to chase it out a little bit laterally, and that would again be in one of the natural creases that we have all around the side of the eye. Okay? So if you look here, these are the skin excision markings that I put on Vicki. There's certain amounts that we need to make sure. You need to make sure that you keep about 9 to 10 millimeters here of upper eyelid from the lash margin to the lower part of that incision, so that the eyelid function is okay. And there's a certain amount that you should ideally keep about 10 to 15 millimeters from where the eyebrow cilia or hairs are to the top part of that excision. And then you again do a pinch test to get an idea of, is that going to close okay, and I think we'll be fine here. So the next thing to do is give the local anaesthetic. So we use some lignocaine here, and that's with some adrenaline in it as well. The adrenaline helps with some hemostasis. It has a vasoconstricting effect, so that means it shrinks some of the local blood vessels to help with bleeding, help control bleeding. Okay, Vicki, so I'm going to start with the injections now, alright? Okay. Just give me a sharp scratch. And you're going to feel stinging now as this starts to go in. The idea with this local anaesthetic is to get in the plane between the skin and the underlying muscle underneath, and then this helps lift the skin up. Actually, it makes the subsequent removal of the skin a bit easier. This is the worst bit of the operation in terms of discomfort. It's the sharp scratch of the needle, and then as the local anaesthetic goes in, it is a very mild acid, so it does cause a bit of stinging, but it lasts for about 10 or 20 seconds. And then before going ahead and doing the operation, I will test everything to make sure that it's nice and numb. It takes away the sensation of pain, but it doesn't take away the sensation of pulling and pushing. Those are different nerve fibres. So you may still feel a bit of pulling and pushing, but shouldn't feel anything sharp. Okay? You can see now there's a suture in here. This is a stitch that's running, and it's a little continuous stitch that just runs along the length of where the incision's been made. There's one on either side, and this stitch is a removable stitch. It needs to come out after about 7 days. 5 to 7 days would get you back to get that stitch, and it's just something that pulls out. Everything's a little bit swollen and it's a little bit bruised. There's some marking still from the pen, but this is an idea of how it would look roughly after, or this is how it would look after you had this procedure done. It may stay a bit bruised for the next week or so, and what we're going to use is some very cold swabs, so some swabs in ice to help try and bring some of that swelling down. That's the same thing that I advise you to do at home.
Well, here I am, one day post blepharoplasty that I had done yesterday afternoon. Very surprised with the procedure itself. I was no problem at all. Much better than what I expected. However, I did follow all my post-op instructions with using ice gauze and ice packs on my eyes post-operatively, and slept pretty much propped up on about 4 pillows, but I had quite a good night's sleep. Feel absolutely fine today. Just got a fair amount of bruising. Did take some paracetamol last night, and I have taken some this morning. So here we go.